Welcome to this edition of Supermerse Halloween! Alright guys, so today I have Anna, Portia, and Bella who are going to help you guys go through some code scenarios of the equipment that we might need to use, where it's located. So here we go. So you have just finished intubating a 10-year-old patient who is hypothermic, and the provider would like you guys to obtain a core continuous temperature. Where are you going to obtain that, and what is it going to be? Alright, so we come in, we got the temp Foley, we have the rectal thermometer,
the prong cord to connect to the wall.
So either way, if you put a rectal thermometer or if you put temp Foley in, you will need this connector as well. Alright, good job. Alright, so our next one that we have is you have a Benadryl overdose who currently got intubated, and the provider would like accurate urine output. Where are we going to find a piece of equipment for that?
Same drawer.
Same drawer, and it's going to be, yes, your Foley kit. And this is all inclusive. This comes with everything. So if you take a look, it has your betadine, it has your sterile gloves, it has your lubrication, it has your catheter, it has your collection bag, and it has your holder. So if you put in a temp Foley, you want to make sure that you also grab the U-bag kit as well. You might also need some betadine for that and your sterile gloves. So the next one you guys have is you have a GSW to the left arm, and the blood is spraying everywhere. What is the first thing that you are going to do?
Apply direct pressure.
Alright, so we're going to apply direct pressure with our 4x4s. If that doesn't work, what do you do next?
Tourniquet.
So we go for our tourniquet.
2 fingers above wherever the
2
wound is.
fingers above the wound.
Rip this all the way off so it's easier. Unless it's Anna.
You wrap it around, and then you're going to
Twist
twist until the bleeding stops.
And then it clicks in there.
Alright, and now, so we have the wound stabilized, and we just want to wrap it up. What can we get out of this drawer? Some Curlex, right?
Yeah.
To wrap and close that wound. Alright, so the next thing we're going to do is the gyroscope. So you have a patient that is about to be intubated, and he's an adult patient. The provider wants you to use the gyroscope. How do you set up our gyroscope?
Turn it on.
So you're going to turn it on. You have your
S3 or S4 for an adult.
your blades S3 or 4, and they are down here.
1 and 2. 2 for kids.
Okay.
And
And then you're going to grab the 1 cord. Well, and let's get this plug and play up close.
Alright, just like charging that phone.
Yep. Yeah, bang bong.
And then
And then it's on.
it's on.
Now, if it comes up with a split screen, A and B, over on the side,
Please hold.
so if this screen comes up, you're going to hit A or B.
B. You're gonna hit B.
Alright, so you're going to hit B, and it's going to bring up the full screen. So, if you're about to intubate a patient and you need RSI medications, where are you going to go, and what is the code?
1, 3, 5.
Alright. And there is our RSI kit. Alright. Also in this cabinet is our EZ-IO gun and our Narcan. So right here is our intranasal Narcan. With that, you also need an atomizer to mist into the nose. If you use this Narcan, you need to make sure that you pull it and bring it back in here. You have a trauma patient that is unstable that comes in. What size IV are you going to use, and where would you find them?
As big as you can get.
So that is the 14, and that is the 16. And this is for unstable adult trauma patients. All right, so you have a patient that is currently in SVT. We are about to administer adenosine to this patient. What do we need to get to prepare for adenosine?
Need the life pack.
All right, so what are we putting them on the life pack?
You're gonna put this like shock stickers, and then you're also gonna put EKG stickers and make sure it's running continuous.
All right, so we're going to get the EKG monitor, and we're going to put them on an EKG, and we're going to have them run for continuous. Now, you're about to administer the adenosine. So what are you going to use? So you're going to use a 3-way stopcock that is found right in here, and you're going to use a flush as well. Where are the 3 places that we can get ET tubes? So the number 1 spot is going to be the difficult airway cart over there. Number 2 is going to be over here. We have it right over there. And number 3 is, I'm not going to open this cart, but it is in the Broswell cart. So you have to find sterile gloves, because I'm about to put a Foley in, and I'm screaming, I need 8.5 for the sterile gloves. They're going to be right in here. All right. Along with that is going to be your NG tubes, or Salem sumps for decompression, and your feeding tubes for putting in feeds or medications. So you have a patient that comes in with a GSW to the right shoulder, and you notice that their trachea is deviating towards the left. What do we have to do? Needle decompress. Okay, so the first thing we're going to do is get our spear needle.
You can't find this
From up here. And if you, what, Bella, if you can't find it,
this, you can use a 14 gauge IV.
Oh man, you can get a 14. Okay. So after you do a needle decompression, is it okay? The patient's fine. They can go home.
No.
No, you gotta put a chest tube in, right?
You need the atrium.
So can you use the infant/peds for an adult patient?
No.
No, but can you use an adult atrium for a peds or infant patient?
Yeah.
Yes. And then, so we got our atrium. What else?
You need the procedure.
We need our insertion kit, so a surgical insertion tray. And then way back in yonder is going to be all different types, sizes of your chest tube. You will need all 3 of these. Alright, next, you have a patient that comes in and their blood pressure wants to play in the toilet. What are we going to do? Oh, whoa! It's the ghost of 62.
Okay.
So talk to us.
Okay.
What do you need
Pressure
for?
bag.
So we got a pressure bag. What size pressure bag?
500.
500.
You're gonna need the fluids with it too.
Okay, 500 bag of fluids.
You're gonna need the adapter.
Yep, you need your clamp.
You're gonna need the tube that goes into the machine.
Yep, our cable. Alright.
Then you're gonna need the stopcock.
Yep, so this is the tubing, okay? And then what else do you need?
And then you're gonna need your
You need your insertion tray.
yep, which is right here.
And if they want extra needles, there's extra needles here as well.
Yes.
Alright. Well, good thing Porsche scared off that ghost of 62. But now here comes Frankenstein of 62 for Bella. You have a patient that unfortunately has passed, and the provider has said the ME is going to be taking his time to get here, and they have to go down to the morgue. What do we do, Frankenstein? The postmortem kit, right up there. Alright, so now that we're getting into the chilly months of Christmas, brr, if we have a patient that comes in that is cold, what is one way that is non-invasive that we can warm the patient?
Fluid warmer.
The fluid warmer. So if the fluid warmer doesn't work, we have to go into more invasive warming measure. What would we use?
Bear hugger.
The bear hugger. And when we use the bear hugger, what do we need?
The machine.
So we need the machine, and we also need to make sure we monitor their core temperature with either a rectal probe or a temp Foley. And then next we have, if we have a patient that needs MTP, they just got blocka in the icy winter, what can we use? Rapid transducer, which if it doesn't come with the tubing, it's right there, and it's over on the adult side. This is nice because not only does it push 750 cc's a minute, but it'll also warm your little cold trauma patient. Oh man, so last couple guys, you're doing so great. You're doing so great here, boys. So, if we have a patient that is on the Dynamap, right, our amazing techs came to us and said that we have a low blood pressure, what should we start doing? Check the manual.
Wow.
Alright, so our manual blood pressures are right in there. And then, if we have a neonate, so this child is just freshly born, and we can't get IV access on them,
Oh no.
what are we going to do?
Umbilical vessel.
So we're going to put in an umbilical vessel catheter, and that is right at the top. We are not. Our providers will, but...
We can get it.
But we will get it. That is correct, Anna. And then, our last one. If you are in dire need to give some fluids rapidly, and you don't have the rapid transfuser, what can we use?
Pressure bag.
Pressure bags, right? So we have a liter bag, and we have 500 bags. Now make sure that when you are putting in choosing your bag, that you keep a 500 cc's to a 500 pressure bag, and 1,000 cc's to 1,000 liter bag for pressure bags.
Is he gone? I think so.
I'm still here!
Zach told us everything we know.
Yeah!